How do we regulate the market in a way that reduces the harm that drugs are doing in our society? Traditionally, harm reduction is defined as providing services to users without requiring abstinence. I'm going to define harm reduction here as an interim step towards a public health, human rights model of drug control. Harm reduction asks the question, how do you reduce the harm to individuals in society given the fact that some people will use drugs? It is not a new phenomenon for us. It goes back to the beginning of recorded history. We are completely comfortable with a harm reduction approach when we're dealing with other significant social problems. How do we deal with sexually active teenagers? We collectively agree that teenage pregnancies should be discouraged. We all believe that. So how do we deal with it? We do not criminalize youth who are sexually active. We do not beat on them. We do not judge them officially. We do not put them in jail. What we do is we do a public health approach. We engage, we discuss, we educate, we provide prescription drugs when necessary. A young woman who shows up in her doctor's office and asks for birth control will get a yes response in Canada. How do we deal with women who drink alcohol when they're pregnant? Significant social problem for us. And at no point do we discuss criminalizing them. So what do? We look at the context of the behavior, and we have those discussions. We talk about poverty, we talk about marginalization, we talk about lack of power for women. Those are the discussions we have. Those are public health discussions. We go quickly and comfortably to that place. How do we deal with youth who huff gasoline? Significant problem in some rural communities. And again, we can't criminalize gasoline. So we quickly go to the context of use. And we look at how can we work with the context of use to reduce this behavior. What I am suggesting is we apply exactly the same techniques to working with drugs. We have the best example of a harm reduction program in Vancouver is Insight. Insight is our supervised injection site. Insight is the most researched supervised injection site on the planet. When Insight was being proposed, we had a battle in our city. And there was a huge amount of fear. Chaos in our streets was predicted. Increased drug dealing, increased death, increased violence. Exactly the opposite has happened. The prediction and the fears and the reality are completely different. The research has told us that there has been an increase in public order as a result of Insight. There's been safer injection practices. There's been reduced sharing of needles. There have been referrals to other treatment centers, and nobody has ever died in our supervised injection facility. Here is the image of the front door of Insight. Look at the language on the door. It says, "Welcome to Insight." That's interesting, because people who go to Insight have often never felt welcomed anywhere in their lives. That process of marginalizing is absolutely consistent. And here is a facility that welcomes our most marginalized. And they can come into a program and do what they used to do in back alleys with puddle water. They can, in a clean facility supervised by healthcare workers and other health professionals, in a clean, attractive-looking place, participate in what is a health problem. And they are engaged to do it in a way that is as healthy as possible for them. There's also the chill-out room, where people are also welcome to hang out at the end of the experience and talk to the counselors and talk about their health and psychological needs. Naomi is a program that is just wound down in Vancouver. It is the North America Opiate Medication Initiative, where we prescribed heroin. We prescribed a drug that is traditionally seen as the big bad drug in our society, and what we observed is when daily intravenous drug users are given heroin in a clean, controlled fashion, they tend to get healthier. And what this program did is demonstrated clearly the benefits of prescription of heroin. There have been significant calls for change, specifically movement towards ending drug prohibition and using a public health human rights model to regulate currently illegal drugs. Looking at this through mainstream media, I start with October 1969, marijuana. Should it be legalized? It was asked by Life magazine. Time magazine, in May of 1988, said, should drugs be made legal? The Economist has been repetitive in their request for change. Bring drugs within the law. In 1993, this particular issue had probably a dozen articles in it, and the case for legalizing drugs. In 2001. The National Review, a right-wing fundamentalist Christian magazine in the United States, had Going to Pot, the growing movement towards ending America's irrational marijuana prohibition, as a cover story. More formally, this is a list of significant national reports that have all had at least one conclusion. The conclusion that drug prohibition causes significant problems in our society. The lens of these reports is all different. Sometimes it's about Aboriginal issues, sometimes it's about women, sometimes it's about HIV and AIDS, sometimes it's about the downtown east side. But all of these reports have the common theme. We have a problem with drug prohibition in our society. Another significant call for change has been LEAP, which is the Law Enforcement Against Prohibition, where police officers, border guards, judges, those folks involved with the enforcement industry are banding together and speaking out. For me, the discussion shifted when the Senate committee report was released, specifically their report called Cannabis, Our Position for a Canadian Public Policy. And they started to use in this report the language of a regulated market for all currently illegal drugs. Then there was the City of Vancouver Prevention Report, titled Preventing Harm from Psychoactive Substance Use. And what they observed in that report is the city cannot prevent drug problems unless we regulate the market for all currently illegal drugs. After that, the Health Officer Council of BC, which is the group of physicians in our province that are the voice of public health. That group released a report, which was a public health approach to drug control in Canada. And what they said is, we need to regulate the market for all currently illegal drugs in order to reduce health and social problems. The Canadian Public Health Association, which is the federal public health voice in Canada, had a resolution where they said there is increasing recognition and concern that indiscriminate prohibition of substances is actually a source of many harms. And they recommended regulation again. How we control drugs in our society is directly connected to the problems that we experience. What we have here on the bottom are a whole variety of different ways of controlling drugs. On the far right, if we legalized and promoted drugs, if we looked at the problems that we have with alcohol and tobacco, we know that what we will be doing is having a huge amount of corporate profit and significant social problems. We know that from having a century of exposure to alcohol and tobacco marketing. If we just prohibit drugs, what we get is illegal market gangsters and huge social problems. The graph of social problems never goes down to zero. All societies have problems with drugs. The question is, how do we manage these problems in a way that reduces harm? And the answer is somewhere in the middle. between these two extremes. It's not about legalizing and promoting, it's not about the free market, and it's also not about prohibiting and just using the police. It's somewhere in the realm of public health. And public health is the place where we can have the discussion of the regulation of all currently illegal drugs. Use tools that are actually appropriate for drugs and help us as a whole, as a society, to reduce the harms. Evidence-based policies is not about surrendering. It's about actually doing the work in a way that works for all of us.